Hi, my name is Dr. Mike Gorman. We're going to talk today about migraine headaches. One of the things that comes to mind when I think of migraines after treating them successfully for almost 20 years now is the impact that they have on people's lives. Obviously, anybody with any health condition, any kind of chronic pain, any things that have a negative impact on their life, it impacts them into their family and into work and other things. But I can't think of very many things that have a bigger impact than migraines. I mean, when people have serious migraine headaches, they end up having to oftentimes leave work, call out of school, go home, have to be in a dark room, a quiet room, right? I mean, some of the ramifications are really significant and serious. And so one of the things I want to talk about today is some holistic perspectives and solutions to migraine headaches and how we're so successful at treating those, and some things that you can keep in mind with that. So one of the things that works great for any kind of headaches, especially tension headaches, but in particular migraines, is chiropractic. Now, how does that work? Well, the upper neck is one of the most common areas that we actually find nerve interference. The tension of day-to-day life, stress, all the different things that we're bombarded by, the toxicity in the world, genetically modified foods, food allergies. These are all things that we can test for, address, look at, and educate you on, and that's part of what we do in our practice. But the upper neck in particular, when that gets out of alignment, that will pinch the nerves at the occiput, at C1, C2, in that upper neck area, and it literally can affect, and does affect, the blood supply that goes up into the head. So that causes all different types of headaches. Migraines in particular, if you notice, many people get something called an aura, and that's where they can get flashes in their eye, where they have issues with very dark spots, bright light bothers their eyes. They have a lot of things with eyes. Why is that? Well, when the upper neck is out of alignment, that's actually where the signals go, and that's where it sends the messages to your eyes. So that's no surprise. See, in natural and holistic care, we're looking for things, and my big approach is I want to know things that make sense. Like, we want to have a common sense approach to health and to our family's health. And so when we look at that upper neck and we say, well, that's out of alignment, it affects the nerves going up into the head, it affects the blood supply into the head, and it affects the nerves that go to our eye. So it's not a surprise to me as a holistic chiropractor that when migraines get bad enough and this gets pinched, or what we call subluxated enough, it literally affects the eyes. So that's a connection that neurologists and other doctors say, we don't know why that is. And we say, no, we know exactly why that is. And so that makes sense. That's basic anatomy and physiology, right? So by addressing that and by doing gentle adjustments, we're able to help dramatically with migraines and headaches with that. But there's a second piece, especially to long-term migraines. And in acupuncture, if you ask 100 acupuncturists and you say, what's the cause of migraines? Obviously, there's many causes, but most of them would say, first and foremost, the thing at the top of their list would be the liver. And you might think, gosh, how does the liver connect to that? Well, what's fascinating is anything you don't understand between chiropractic and anatomy and physiology, you can explain 80-90% of things, but whatever doesn't make sense, you can usually explain through the acupuncture system. And so being trained in acupuncture, we also understand that the liver relates to the eye. So part of the connection with the liver and the eye and migraines, that's connected. So that makes perfect sense. But also the liver deals with toxicity. So when patients get migraines, they almost always have an issue with toxicity. So we can do hair testing, urine testing, different things to measure exact levels of toxins to know exactly, we don't have to guess, we know exactly what to do for that. We do a series of chiropractic adjustments to take the pressure off of the neck, and that helps on that end. But here's one of the dilemmas that is really frustrating in the migraine sufferer's world. The only treatment that neurologists and family doctors and people typically give are medications. What do medications stress in the body? The liver. It's even well known, if you're on any kind of medication long term, they every month, 2 months, 3 months, they have you go in and they actually draw blood to test your liver enzymes. Very well known, very well documented, because they know it stresses the liver. So here we are taking medications that are supposed to help the migraines, and yet it's actually stressing your liver, which is actually affecting the migraines even worse. So now you've got a vicious circle going on, right? So that's impacting your life. What else is that impacting? Relationships, family, all these different things, right? So our approach is to identify the physical things that affect migraines, which would be things like the upper neck. We can do tests for certain cranial nerves, nerves in your head, cranial sacral therapy, different things to help with some of the nerves that go to your eye and affect migraines. We're looking at biochemical things. Certain food allergies, in particular wheat and gluten, can trigger migraines, but dairy and certain other food allergies and things we can test for. Nutritional deficiencies, certain vitamin deficiencies can also trigger and exacerbate and make worse migraines. And then I mentioned already toxicity. And when the body's loaded with toxins, it puts a stress on the liver. The last thing I'm going to say about that, and obviously stress, okay? We do different things related to stress management and different techniques we have to help address stress and from that perspective. But the last thing I'm going to say related specifically to migraines is very often, especially in female cases, they will find that they get migraines and headaches during their menstrual cycle or when they're premenstrual. The reason for that is they get a surge or a rush of hormones at that time. And when they get that surge of hormones, it's the liver that's actually supposed to break down those hormones and actually help to regulate and balance all the hormones. If the liver is already too overworked and too overburdened from all the toxins, it doesn't get to do that. And those extra hormones build up in the body and they end up causing and contributing to migraines as well. So when we start to look at all those things, we want to look at the root causes, which would be things like the neck and the liver and all the things that we already mentioned. So our philosophy and our common sense approach is really to identify what is it that's interfering with your body and what does your body need, and remove the interference, give the body what it needs, and then educate you about what you might be doing to interfere with things and what you might need to do in order to give your body some things related to your lifestyle. And when we combine all that together in a holistic approach, then not only do you get well, but you get permanent lasting relief and you stay well. If you have any questions or look for more information, please visit our website, www.gorman-health.com.